Hello and welcome. Let's talk about dislocation, including shoulder and hip dislocation. So, what does it mean by dislocation? Dislocation means disruption of joint with a total loss of contact between two articular surfaces. Whereas subluxation means a joint is said to be subluxated when its articular surfaces are partly displaced but retain some contact one with another. Now, this is an X-ray picture showing dislocation of the hip joint. Now, commonly affected joints in dislocation: shoulder joint, hip joint, knee joint, elbow joint, and ankle joint. Now, what are the factors maintaining stability of a joint? The surrounding muscles, like muscles attaching the humerus to the pectoral girdle, long head of biceps, and long head of triceps. Fibrous capsule, ligaments like glenohumeral ligament, transverse ligament, and other. Atmospheric pressure, coracoacromial arch, musculotendinous cuff or rotator cuff, and the glenoidal labrum that helps in deepening of the glenoid cavity. Now, these are the factors maintaining stability of the joint. Now, fractures versus dislocation. The fracture may be defined as an structural breach in natural continuity of bone and cartilage. Dislocation means disruption of the joint with total loss of contact between two articular surfaces. The natural continuity of bones and cartilages is lost in fracture while preserved in dislocation. The joint disruption is absent in fracture while present in dislocation. The cause is trauma, pathological process, and stress in case of fracture, while the cause is trauma and congenital in dislocation. The treatment of fracture is reduction, immobilization, and treatment of any causative pathological condition. In case of dislocation, the treatment is reduction and rest. Now, which joint dislocation is most common and why? Dislocation of shoulder joint are frequent because of laxity of the ligaments and disproportionate articular surfaces. Initially, the dislocation is inferior or subglenoid, and this is followed by subcoracoid, subclavicular, or in other areas. The axillary nerve may be affected in inferior dislocation. Now, let's talk about shoulder dislocation. Types of shoulder dislocation: anterior dislocation 95% of the case, and posterior dislocation. Anterior dislocation includes subglenoid, subcoracoid, and subclavicular. Now, clinical features. Symptoms include severe pain on affected shoulder, inability to move the limb, and patient supports his limb with other hand in slight abduction. Signs include restricted movement, pain on movement. Now, this is a picture showing dislocation of shoulder. Hamilton's ruler test, where the straight ruler touches the acromion process and lateral epicondyla simultaneous on the affected site. Calave's test. On the affected side, axillary folds are lowered and so the girth of the axilla is increased. Dugas test. The patient is unable to touch the other shoulder with the affected limb. Now, the investigations. X-ray of the shoulder joint, both views is done. Treatment. Close reduction under general anesthesia with Kuchar's method, Hippocrates, followed by immobilization with collar and cuff sling with triangular bandage, and immobilization of the affected limb for 3 to 4 weeks. If unsuccessful, open reduction under general anesthesia is done. Now, treatment of the recurrent shoulder dislocation. Treatment is operative, which is done after 3 or 4 such dislocations. Bankart procedure, Putty-Platt operation, and Barry-Stroh's operation. Now, complication of the recurrent shoulder dislocation: stiffness of shoulder joint, umbilical cord injury. Now, let's talk about hip dislocation. Classification of hip dislocation. The most common is posterior dislocation, about 95%, and then anterior dislocation and central dislocation. Now, clinical features of hip dislocation. Symptoms: there is a history of trauma, of road traffic accident or fall from considerable height in flexed knee, mine accident or air crash, pain, deformity of the limb, and restricted movement of the limb. This is a picture showing dislocation of the hip. Clinical features include signs like deformity of the limb, where shortening of the limb and hip is flexed, adducted, and internally rotated. A hard mass due to depressed head in the gluteal region, restricted movement of the hip. There may be impairment of function of the sciatic nerve, vascular changes, arteria dorsalis pedis. General examination to see any other bony injuries like fracture of the patella and head of the femur, supracondylar fracture, chest and pelvic fracture can be done. Investigation includes X-ray of the pelvis, including both hip joints in anteroposterior view and oblique view. X-ray of ipsilateral femur, including knee joint, and CT scan to detect acetabular dislocation. Treatment: close reduction under general anesthesia followed by external traction post-operatively for 6 weeks, and on starting of the active movements as soon as the pain subsides. After 4 weeks, non-weight bearing walking, and after 12 weeks, weight bearing walking should be done. Hip dislocation is rare because the acetabular cavity is deep. The joint is surrounded by strong muscles and ligaments. End of the topic.